When there's a COVID case anywhere in Guilford County, in a classroom, a business, or your favorite restaurant, the health department is contacted. So why do some places shut down and others stay open? Well, we're going to get down to that. County Public Health Director Dr. Julia Van is here to answer your viewer questions. And here's how you get your question answered. You text us the question. It's 336-379-5775. Again, 336-379-5775. Remember, this is a text-only number. If you want your question answered, please do not call, but do text us so that we're able to do that. All right, Dr. Van, this is a question that I get all the time. Someone says, there was a positive COVID response at my workplace. They didn't tell everybody and they didn't shut down. Don't they have to?
Yeah, so hi, Tanya, and thank you so much for having me tonight. I appreciate the opportunity to answer questions for our community members. I can understand why this is a little bit confusing for our residents because you would think that the response would be the same in every situation. Well, it is not that simple. First of all, businesses or any other place that has employees that are affected by COVID, they are not responsible for necessarily making a wide announcement to their entire workforce. They can do that if they choose to, but they are not mandated by the law to do so. However, the health department is responsible to conduct that investigation in the workplace or in a when it comes to a positive case. So we are getting involved in that entire process. We are identifying close contacts, and we can talk a little bit about close contacts in just a little bit. And we make the determination of how many individuals were exposed to that positive case. If that business, restaurant, or entity realizes that with all of the close contacts that have come in contact with that positive case, they are not able to provide the services or operate in a manner that could continue to be efficient for them, they can choose to close that business or that restaurant or that place. In a general rule of thumb, the health department is not recommending for those to shut down unless we are finding an outbreak or a cluster or a high number of cases and a lot of close contacts, and we make that determination. So as you can see, the decisions are based on what the health department finds from that case investigation, and it's also a very case-by-case situation based on what we find out from that investigation. So I hope that that gives our viewers and our listeners a little bit of an insight on how those decisions are made.
Yes, absolutely. I think so, because I think everybody thinks that everything just needs to shut down, and that is not the case for it to continue to be safe. We do have another text question. This person says, I've already tested positive for COVID and I've quarantined. If I'm exposed to another positive person, will I have to quarantine again?
That is an excellent question, and we have been answering that a lot recently because we are learning more and more about COVID as we go. So at this time, we know that individuals that have tested positive for COVID are able to build a little bit of immunity in order to protect themselves for some spread in the future. So as of right now, and we know that this may change as we're learning more, as more research is being done around COVID, that anybody that has a positive case for the next 3 months from that positive case will not have to isolate or quarantine if they become close contacts of another positive case. So that is the recommendation that is coming out of the health department right now. But again, I want our community to know that we need to be flexible in the way that we are understanding these guidelines because we are learning more and more every day. So to just sum it up, if this particular individual tested positive for COVID, for the next 3 months from that diagnosis, if they are close contacts, they will not have to isolate or quarantine.
And of course, all of this, just like you said, is subject to change as we learn more. But as of right now, that's how it stands. Okay.
That's true.
Gotcha. All right. This person is asking, are COVID test results coming back faster now, even if you don't take a rapid test?
Yes, and I know that that has been an area of a lot of anxiety and concern, not only for our community members, but for us as well, because we truly can't perform the public health measures and mission if we don't have that quick turnaround of tests. So we have been extremely focused on working with our commercial labs, working with our state partners to make sure that that turnaround time has dropped. So in the last month or so, I would say that the turnaround time for the commercial labs is between 3 to 4 days, but we're seeing results coming back even in 48 hours. So those times have dramatically improved, and we're very excited about that.
Okay, good to know. All right, we're going to continue to take your text questions. You can see the number right there at the bottom of your screen, 379-5775, and we'll be right back.